It is our general responsibility to protect the NHS brand, but we shouldn't be driven as a first consideration as what will this look like in the headlines in the local newspaper. Our first consideration has to be the health of the population, the evidence base behind which the decision is going to be made, and showing that we're responsible stewards of public funds. That's our job, and that's what protects the NHS brand, to be seen to be professional, to be seen to be doing the right things. I think what we're looking at here is a culture clash between the centre, which understandably has to manage an overtly political agenda, and localities which are more accountable to local people but have to get on with the core work which they're given to do. So we don't feel at a primary care trust level that we should be driven by considerations of headlines per se. That's not our job. Our job is to get on with the work that we've been entrusted to do, and do that to the best of our ability. Let others handle the politics and the overt politics. The easy way out of managing adverse headlines in the short term is simply to say yes to every specific request that comes our way that has caught media attention. I don't believe for a moment that any member of the public would recognise that as a legitimate criterion for the prioritisation, the budgeting debate that's going on at the moment. Well, politics and healthcare make unhappy bedfellows. I think the healthcare should be driven primarily by that special relationship between the doctor and the patient. But what we need is a way of keeping the overt politics, and certainly the party politics, of whatever colour, right away from the bedside. Let the doctors and managers and the patients they work with get on with the business of health and delivering health care. Give us the overall direction of travel, but keep out of the bedside decisions. We're going to concentrate on the job as we understand it. We're going to concentrate on developing our procedures and our processes to be as rigorous as possible, doing what we believe the government is asking us to do, which is to look at considerations of effectiveness and safety and value for money for the whole of the population, to be able to tell a credible story that we are improving the health of the population and tackling inequality, and to make a virtue of the fact that we are resisting overt media pressure where we think it conflicts with those values. So is there postcode rationing? Well, in a sense, yes. You could argue that is the defining purpose of a primary care trust, to look at the people who fall within its postcode, given a budget for them, so we ration that to what we can afford, and try and get the maximum health gain and reduce some of those totally unacceptable inequalities which we experience. So that's what we do.